Thank you so much for making the time to speak with me. I'm so excited to learn more about your work and about the future of healthcare as you see it.
Yeah.
So, let's get started by you introducing who you are and where you work.
So I'm Ivelyse Andino. I'm the founder and CEO of Radical Health. We look at health equity through meaningful conversations. So we do that both in person, where we have meetings and workshops in historically marginalized communities talking about health and what that means to the people who are the most directly impacted. And then we have a tech side where we built out a Know Your Rights for Health app that uses AI and helps pregnant women of color ask questions to make sure that they know their rights, they know what they're getting into, and basically using their own voice and agency to change the way healthcare is delivered and ultimately reduce maternal mortality.
Sure. So we're at a health conference, and my curiosity is, how do you see or how do you define health, especially when we're speaking about marginalized or underrepresented populations?
Yeah. I think it's really important that we define health in really basic words. I think in these conferences, and especially in this industry, we love to use words that are created by people who are really far removed. So when we talk about health, I think it is essentially centering people, both like where they live, their environment, their emotional state, and all of the systemic and personal biases or structures that are racist. So I think it's really important that, like, when I define health, I think about it as equity for all, equal health, where we're centering those that have been the most invisible and forgotten and making sure that their voices are heard regardless of their background, regardless of their education, but just because, like, they're human.
Yeah, when we speak of equitable health, let's get down to the nitty gritty. What does that mean from a policy level, and how can we really reach people at the level that they're at?
When we look at, like, the history of health, right, and the atrocities that were committed long ago, from the Tuskegee experiments to sterilization of Puerto Rican women, we know that this is just not fair. When we look at healthcare today, where we have Black women dying 3 to 4 times the rate of white women in the United States, where the U.S. is the most dangerous developed country in the world to give birth. I mean, we're living that, and those happen, like, those inequities happen. I mean, from a systemic level, so who has access to healthcare, who can wait, how long you have to wait for a provider visit, to even then, like, the small, microaggressions, like how often are, in the provider levels, like, encountering both microaggressions, but also, like, direct, just harmful, hurtful, like, things. And so when we look at that on both sides, I think it is, I look at it as, like, there are big things and there are small things, and then there are system things that we're trying to solve.
Sure. And so, as a woman of color, as a Black woman, my curiosity is, how do we empower people, individuals, women of color, just marginalized community and underrepresented populations, to be proactive and to help shift that paradigm, to be empowered, to take control of their health, to be a voice, etc. So, how do you see that shift happening?
I mean, I think, one, it's important to acknowledge that as people of color, I'm an Afro-Latina woman, like, we are resilient. We've lived through all of the life experiences and the historical things. So we are resilient. And I think oftentimes we put a lot of onus, right, on the patient. Like, you have to do more, you have to go to your visits. The way that I look at it is kind of twofold. I think individually we can start to ask more questions. The same way we ask questions about education, or we ask, questions when we're going to buy a car, we definitely could look at health the same way. I always say that we probably spend more time picking out what we're going to eat for lunch than we do thinking about our next appointment and what we're going to ask our providers. The other thing, I think, on another level, I think it's what you're doing, what I'm doing, is creating representation. So the more seats that we can take up, the more we get hired into positions of actual power, especially in health tech, where women of color are less than 2% of the CEOs. That representation in those positions where we can then make the calls and where we can actually have influence over the policies, over the AI that's being developed, even the content that's being created, I think does wonders. And so I think it's both, individuals, stepping up, but I also think it's a responsibility of the system at large to make space and be inclusive, not just from the D&I perspective, but, like, actual like longevity and making more space.
Sure. So, any overall thoughts on the issue of health equity or health inequity? How do we shift the paradigm? What is radical health for the future of, let's say, 20 years from now?
Yes. I really see, right, health equity. I mean, to be fair, when I'm in my communities, we don't use the words health equity, right? And again, that's a very system, healthcare language. I mean, what we look at, people want to be well. They want to live. They want to see their grandchildren. They want to see their family members thrive. They want to love. And they want to do that, right, where their body feels well, where their hearts feel well. And so when we see the future, right, I don't want to keep talking about equity. Like, I think we need to be done with this. I want us all, right, to like live our full lives the way we were intended to. And more so, right, for radical health, we see that in both community, where we're connecting person to person, where we're sharing our full lives, not just like clinical on one side and then our emotions on the other, but where we can combine that all. And more so, I think, I want to see, full transformation of a system that we know is broken on so many levels, and where folks at the top, profit and benefit, and people like, at the bottom are dying. And I'd love to see a redistribution of that, where the folks who have often been forgotten or neglected, or what we consider to be the bottom, are the ones that are actually leading the change and being the inspiration moving forward.
Is there anything that you'd like to address that I didn't ask you? This is your moment. Take it away.
My moment. Oh my gosh. I'm super lucky to have this. I just think I encourage, women, allies, everyone to step forward. We can feel like it's a little polarizing, but I think everyone has a role. So to whoever, is here, whoever's listening, big and small, we all have roles to play, and I encourage everyone to get behind that. Whether you're hiring, making sure you center folks to hire, whether you are a clinician or a provider, I think those are really important roles. We got into this and into healthcare to help and to heal, and your voice is just as important. So how do we all work together? How do we see one another? And how do we do that without a lot of the power dynamics, and just like begin to connect as people?